everybody. Welcome to another episode of the Successful Women's TV show. My name is Galit Ventura Rosen. I am co-founder of Everyday Woman TV. One of my favorite things to do is to spotlight women all over the world that are doing amazing things and helping other women as well as men. My guest today actually comes from the city I love and call home, Las Vegas, and she's a dear friend of mine. Please welcome Dr. Ati.
Hi, Galit. How are you today?
How fun is it that we get to do this, right?
I know. This is so cool.
We get
supporting
to
each other.
Yeah, we get to go dancing, and then now I get to interview you with all
Yay.
of Yay. So first I'm going to share a little bit about Dr. Ati, and then we're going to go ahead and jump right into our topic today, which is, I love this topic. Is it you or is it your hormones? Who can't relate to that at any age? So here we go. Vegas DPC is direct care with a family medicine physician, Dr. Ati Hakimi, 20 years of healthcare experience. It is called direct primary care because when you call, text, email, or see Dr. Hakimi, it will always be her and no one else. Dr. Hakimi focuses on holistic healthcare and lifestyle medicine. She uses a coaching approach that promotes lifestyle changes before medications. Yay. The pillars of lifestyle medicine are focus on one's base and foundation, quality sleep, wholesome nutrition, routine exercise, focused hydration, and mental well-being, which are integrated into the clinic's approach to members' care. I love that. Those are some of my favorite things personally, and I just love that you do that. So let's jump right in, okay? Is it you or is it your hormones?
Yeah.
Walk me through this.
Well, I think that as a primary care physician, my onus is taking care of the entire person as a whole being. And we have really focused on mental health in this country right now as one of the causes and or go-to for our unwellness. And as women, our hormones dictate a lot of our well-being as well. So I am advocating that women also acknowledge that this can be one of the, major causes of mental health not being good, right? So it's just basically recognizing that your symptoms of feeling sad, blue, anxious, all of these things cannot just be a mental health thing, but it can definitely be a hormone thing. It can be an all kinds of hormone thing. So that's why it's important for ladies, please, especially more so. It's really hard getting the gentlemen in, but ladies, come talk to us. Make sure you're getting your labs, your annual exams, and you're finding someone that you can actually have that conversation with before starting medications, right? Before being labeled as someone that has depression, before being labeled as someone that has anxiety, before being labeled as someone that might even have bipolar syndrome, right? Because the extreme changes can really be evident. And what we're trying to do is trying to come to, not a diagnosis, but what is affecting your quality of life. Because ultimately for me as a family physician, my job is to prevent things from happening to my members. I don't call my people patients. They're not sick. So they're my members. So prevention is a part of the healing process that's very important. But as women, our hormones dictate a lot of that healing process, and just to be cognizant of that before you get labeled with any conditions.
All right, so let's talk about that. Let's unpack this a little bit as people, because it's a lot. And as somebody that is a woman,
yes,
who's been dealing with hormones since it feels like the age of 12, I will tell you that I love this conversation so much because I do believe from my own experiences that at times, if you do see I'm not going to say the wrong, but a medical physician or someone that is not a fit for you,
right?
That at times they will put a Band-Aid on it and just write something for you and here you go.
Right.
And when you are aware of who you are, your natural ability to be healthy mentally and physically, you now can compare it to something that may be happening that is not what I call my normal state. And I'm going to use that loosely. Okay, Dr. Ati, I'm going to use this loosely. But as women, when we're attuned, so let's talk about that for a little bit. Those women that are watching today and listening, what are some of the things that we can say, okay, it's time to go talk to somebody, or this might be more natural and more normal? Because I think that's really important to kind of differentiate so we don't feel like we're going crazy, right? And how many of us have had experiences where we feel like we're going crazy?
Yeah, absolutely. I think once again, the model of care that we have in our country doesn't help with some of the concerns that you have. Seeing someone for 10 minutes is not going to give you the ability to express your concerns. And I just want your audience to know that it's not us, it's the system, right? It's a sick care system that we practice. It's not a healthcare system. Okay. So that's why I was trying to emphasize being able to find someone that you can actually have the time to communicate, because you're absolutely right. You know yourself the best, especially as women. We are probably very much more in tune with who we are as a person in terms of our mental health, our physical health, our spiritual health. And you know when something is not right, right? So the difficulty is when you come to one of us, you know, God bless you if you can find a physician in Las Vegas, but I would always recommend trying to find a physician. It doesn't necessarily have to also be, you know, your gynecologist per se. A lot of us are, you know, pretty well versed in hormone treatment now too. I do caution you to make sure that it is a clinician, that it is someone that has experience before you have that conversation, that you're not going on social media and getting your advice. You're talking to your friends and your family about who they have been with and who they trust. That's very important, right? Because that base and foundation, the guidance has to be someone that you can trust to communicate with, that will actually listen to you. Yes. So that's one of the big aspects in our sick care model is we don't have that. So try to find someone like that. I'm also available. We'll talk about that later. But finding a professional that can actually sit down with you and talk with you about what you don't feel is right is very important, because we are all individuals. We present differently. We have so many studies now in terms of hormones. I mean, the latest one of my colleagues just posted is that dry eyes. We even have receptors in our eyes that are estrogen prone. So when we start to lose estrogen and, you know, when we go towards menopause, you can actually be more prone to dry eyes. I mean, it's an insane amount of things. It's an insane amount of things. So that's why you need someone, first of all, that you can just sit down and talk to about what is not right.
So let's talk about that for a second. Okay, I'm a new patient and I have all of these fun symptoms, right? My moods are all over the place. My period's coming and going. I don't know if it's coming or going. I feel like a teenager that has to put stuff in my purse all the time and take it with me everywhere I go. Yeah. And I'm starting to get hot flashes, and this is just a general idea. And I come and I see you. Okay. I come and I see you and I say, okay, I've got to see you. I've got to figure out what's going on with me. Will you take us through the process so those that are listening and watching can get an understanding of how you really work with your members, and someone that might be brand new and just kind of all over the place and feeling a little bit disheartened at this point, that they don't
overwhelmed.
know. God knows how many doctors already tell them 10 different things that are wrong with them, right?
Yeah. Or the opposite, saying nothing is wrong with you. I think that's even worse, right? You know, everything is fine and you know it's not fine. That's more disheartening. So honestly, for me, the first thing that I actually do is I actually do this. We do a meet and greet. I make sure that I can actually meet your needs, because there are some times where I feel like it's not a good fit to pick up somebody that is not going to get that, you know, quality of care, because their ideals are different than what mine are in terms of healing is the first step. The second step is when you do come on board, I literally sit with you, Galit, for at least an hour, and we chat about everything that you just read. right? Your base, your foundation, what you are doing in terms of taking care of yourself. And then you start telling me about, what you're doing on a daily basis. So we cover the medical stuff and the history and all of that. But then we talk about your daily life and your daily food habits and your nutrition and all of that. Because like I said, that is your base and foundation in healing, right? So a lot of women will come to me thinking that they have depression, they have anxiety, they have all these other things, not knowing that the hormones are still a very large player in all of that. So from there, once we have our chat, you talk to me, we come together and we discuss what we want to do in terms of labs, right? So there's only so much I can do on the outside. It's the inside that I need to also check. So this is where it gets a little tricky because insurance doesn't want to pay for a lot of things. I say to hell with them because I can do it all for less than 90% of the value. The same labs you can get with cash pay with not having insurance is about $700. I can do it for like $150, $200, right? Because I pay the lab, and they know I will pay them back. So there's not a third party middleman, with the copays and deductibles and nonsense. So labs are an important part of this overall picture to see what's going on inside of you. And so, the insurance is not going to pay for you to get, these hormone labs when you are having a period because they, being the non-medical people are trying to save money. So they don't see value in that. I've actually started doing that with a lot of my ladies that are also not even perimenopausal, but just maybe in their 30s, things like that. Because what I'm thinking is that can I try to emulate when they were in their good place, when they start to lose their hormones, right? That's kind of the thought process that I'm thinking. I don't know if there's a lot of medicine behind it, but for me, that's where I'm trying to have like a base and foundation of where you were when you were in your sweet spot. Yeah. And then when we start to see the hormones change, because everybody's different. Remember, I told you that everybody's different. There are women that will go through, these hormonal blips that we have without any symptoms. None. Right. God bless them.
Amazing.
Yeah. But that's a thing, right? That's a thing. So, they will go through life just being, without any symptoms. So that's great. But, and then there's the rest of us, I actually went through it as well. And it was tough. It was horrible. It was all the words. So that's why I've become more cognizant of these hormones. And for me, it was literally my mood. My mood went to poop. Immediately my mood went to poop. And like you said, I knew something was wrong, and the hormone thing was also not really on my radar right away because life was hard and all of these things. So I really thought my mental health was deteriorating. And I went to see one of my colleagues that's also a specialist and spoke with them, and they clarified a lot of things. And then I just got into it. I just started doing all the reading and the research, talking to all my colleagues that are like gurus in this field, reading books, all kinds of stuff, right? And educated myself. And sure enough, I was all messed up for me personally in my hormones. And when I started working on that and how to kind of placate that, everything started to improve for me personally. I'm not going to say it's for everybody, but what I'm trying to say is it's an important part of that overall picture, especially when it comes to our mental health, and it's not just your estrogen, progesterone, testosterone kind of world, it's your thyroid. A lot of us have thyroid issues that we're running around that hasn't been managed well or is being managed by people that are not professionals. Right. So I'm having a problem seeing that too, when people that didn't go to medical school, that are not physicians, that are taking on people's health, that don't have the training. This guy is so important and valuable. And when you start messing around with this, it's going to affect everything. Your thyroid affects your mood, your metabolism, your hair growth, your bowel movements, your heart rate, your skin conditions, everything. This is a hormone. That's a hormone. Yeah, your sugars, your insulin levels are very important. So those are also a part of the hormones that I'm talking about. It's not just your, female hormones per se.
Understood, understood. So for
All of it.
me, what I'm hearing from you before we share all about you and where people can learn more about you, where they can set up an appointment, also connect with you on social media. What I'm hearing from you is you know yourself best, and you know when something's a little off, stop waiting. Go find somebody like Dr. Ati that can talk to you. And I know I have women from all over the world that are watching. So, Dr. Ati, do you only work with people in Las Vegas?
So I have a Nevada license, which means that I need to work with people in Nevada. But I do have various patients throughout the state. And if they come to me once a year to get, their care as well, then we should be okay.
Okay,
So yeah, so that's
I
kind of
know
the
that
caveat.
you also do a lot of the coaching as well. So I see like a two-sided part to it.
Yeah.
So for the women that are watching out of Nevada, please also contact Dr. Ati, because she can let you know in what areas she can direct you and guide you and work with you as well from the coaching end of helping with your health. But for the medical perspective, absolutely. So what I'm hearing is we know ourselves best. Let's go, ladies. When something feels off, stop allowing yourself to suffer. There's no reason to suffer. There are ways to help you and to balance you and to work with somebody like Dr. T. So I would love for you to share websites, social media, anywhere that people can get a hold of you and start talking to you.
Yeah, absolutely. It would be my pleasure. So because this is called direct primary care, you can literally go online and find my phone number. It's literally my cell number. So my website is www.vegas, like Las Vegas, DPC, DavidPaulCharlie.com. My cell number is 702-829-0478. I'm currently on Instagram as much as I can, and it's just hashtag Vegas Direct Primary Care, so the whole word. And I do share stories a lot more nowadays about, women's health. So I'm a family doctor. I take care of the whole family, but women's health is kind of starting to become a little bit more of my passion because I'm a woman and I'm going through it. But I do want to emphasize that I just want everyone to realize that quality of life is very important. And that's my goal, is to not just give you quantity, but quality of life. There is a difference, and all of the things that we spoke of really dictate that quality of life, which I try to hold my people accountable for.
Absolutely. And we only have one life. We might as well make it a good one, right?
That's right. That's right.
Absolutely believe that and breathe it and live it every single day.
100%.
It was so much fun getting to learn more about what you do, even though I knew quite a bit already.
Yeah.
But it's so much fun to be able to spotlight you and share your area of expertise with those listening and watching. So thank you.
Yeah, it's my pleasure. It's my pleasure. Yeah. So
about something fun and necessary.
Absolutely.
Not always fun, but it's necessary.
Absolutely. And I wanted to let your ladies know that if you don't have insurance, that's okay, because I don't necessarily work with insurance. It's a flat monthly fee. It's just $150. That's 2 drinks on the strip, right?
Yeah.
And the reason,
or one dinner out.
Where are you getting one dinner out for 150? I'm not.
I'll let you know.
With inflation and everything, it's insane out there. But the onus of what I'm trying to do is I'm in a part of my life where it is more important for me to make a difference. Yes. And that's what I try to do. So access to healthcare, it is a myth if they're trying to tell you that you can't get any care without insurance. Insurance was not made for what I do, which is prevention, to take care of women. And I do practice, gynecological care, pap smears, things like that too.
Wonderful.
So it's all encompassing. Yeah.
I'm so glad you shared that. So for you ladies and for your families, and so anything that you are interested in finding out more about, please reach out to Dr. Ati. She's an expert. She's been doing this a long time. and she can absolutely direct you and help you. And don't, ladies, whatever you do, don't sit around and allow yourself to suffer.
Right.
One of my pet peeves, and it's not really a pet peeve, but I'll go out and let's just pretend like it happened to me recently. I went and I bought a dress, and then the cashier started doing this. And I said, "Oh my gosh, are you okay?" She goes, "I'm having a hot flash." And right away, I want to say, you don't have to suffer.
Agreed.
Her way is not like, I don't know
Agreed.
her, so I can't say anything, but I just want people to know you don't need to suffer, and there are ways to help you, and our bodies change, and then your treatment needs to change, and the way you take care of yourself needs
Well, and the way you eat, right? Soy is a really big no-no when it comes to when you're still menstruating, but when you stop menstruating, because it's an estrogen derivative, you want to pack that stuff on. So those are the things that we also talk about, right? It's not just about, giving you something and walking away. I give you the options that are out there and the ways that you can also start to heal yourself. But no, nobody should suffer like that. And I'm also very, empathetic to that, because been there, done that. Quality of life went to poop. And the problem as a physician is when my quality of life goes to poop, your quality of life is going to go to poop, right? Because I have a responsibility, and I need to be able to take care of people. And the only way I can do that is by being my best as well.
Agreed. Well, thank you so much for joining me today.
Thank you, Galit. I'm glad to have made this happen.
Thank you. And thank you to everybody that's been watching and listening. The Successful Woman's TV show. I don't even know how many episodes I'm up to. I'm probably up to 200 or 300 now. And it's been so much fun for me over the years. So thank you for continuing to watch and listen. And please reach out to Dr. Ati and take care of yourself, ladies, because if you don't take care of yourself, you definitely can't take care of anybody else. Bye, everybody.
Amen. Bye, guys.